Welcome to this week's edition of Hand and Wrist TV, where we will continue to look at our sports injury prevention series. Today we'll look at fighting injuries and prevention in MMA and boxing. We'll have a very special guest later in the program. It should come as no surprise that in fighters, hand and wrist injuries are the most commonly injured areas of the body. While MMA and boxing styles may vary, there are many similar injuries they share. These injuries are common at all levels, from the novice to the pros, and they usually occur during competition. More commonly, the injuries occur from poor technique and striking, and improper gear that doesn't adequately protect the hands and wrists. Injuries can be broken down into two types: acute traumatic injuries, where ligament and cartilage soft tissue injuries can occur, and even fractures and dislocations in more severe cases. Overuse, stress-related injuries can occur, and more commonly in the novice. Common injuries that affect the hands and wrists first start with a metacarpal fracture. This is most commonly called a boxer's fracture, where as you can see on the x-ray here, there's a fracture through the fifth metacarpal. This comes from improper punching technique, more commonly seen in novices or sometimes even inebriated people that have anger management issues, where they strike a wall or unyielding object and they punch with the wrong technique, causing a fracture to the fifth metacarpal. And there are also fractures of dislocations. The next picture, X-ray, shows an actual dislocation of a metacarpal where it's taken off part of the bone underneath it. In this patient, he hit the subject so hard, he actually fractured and dislocated 3 metacarpals, a very devastating injury. Wrist fractures are also common. The scaphoid fracture is one of the more common, as you can see here. It's a little bone on the thumb side of the wrist that is very difficult to heal. It can take up to 3 months for this to heal, and usually occurs from improper technique. There's also wrist dislocation. This shows where the midcarpal joint is actually dislocated over the lunate here, which is a significant injury, devastating blow. Now, in the knuckle, there's a thing called a boxer's knuckle. And the boxer's knuckle can be a career-ending injury to a boxer or striker or an MMA athlete. What happens with the boxer's knuckle is you tear the lining that centralizes the tendon over the knuckle. And you can see here, the tendon is popped out of place. It's pushed to the side. In this, if you get an MRI of this individual, you can see here there's actual white structure there's a little black structure on the top of the knuckle. That's the tendon. And then there's a little white gap next to that. That shows the tear. So these can take a long time to heal, and when you return to punching, can be a chronic source of aggravation, and in a professional boxer or fighter, striking repeatedly weakens that and can be devastating to their career. Wrist ligament and cartilage injuries. This shows a triangular fiber cartilage that is on the little finger side of the wrist. Just shows a little slit tear here from a torquing injury, and this usually requires arthroscopic surgery, but can be highly effective, 95% success rate to treat this. Finally, metacarpal boss. This is a funny name, I know, but it comes from striking repetitively, and it drives a force through the metacarpals down to the articulation with the wrist. The tendons attach here, and you can get a bad tendonitis from the tendons going over this bone spur that forms, and it's right in this area of the wrist, as you can see from this picture. It also, on the CAT scan, you see this bone spur that has a little gap in it. That's where it's been fractured. So sometimes this can be healed with conservative treatment, but in other times can require surgery. Immediately after the injury, even if a minor sprain is present, you'll typically get swelling and pain at the area of the injury. In more severe cases, though, there will be bruising and deformity and limited movement. Initially, treatment should include icing for about 20 minutes, elevating the injured area, putting the wrist at rest, putting it in a brace, taking anti-inflammatory medication, your Advils, Alevs of the world. If that doesn't do it, a specialist should be consulted as soon as possible. Initially, the specialist will get x-rays to rule out a fracture, but usually the x-rays in many cases are normal. A CAT scan may be necessary when looking at the bone detail, an MRI if it's a soft tissue injury. However, if there's a major ligament damage or a fracture, surgery is sometimes necessary. Prevention of these injuries starts with proper equipment. As a hand and wrist specialist, I don't normally endorse products unless one stands out as being far superior to the rest on injury prevention. The Hayabusa Takusha series does just that. Gloves were first invented to soften blows to the head in 1743 and were made of horsehair and scrap leather. It's amazing how far technology has taken us from this to this. But not all of today's gloves are equal. The Takusha series by Hayabusa is equipped with scientifically researched, university-tested technology, allowing fighters to maximize performance and injury prevention. Fusion splinting and dual X closure aligns the hand and wrist in an anatomically favorable position, protecting the hand and wrist from injuries due to misfired punches. Deltra EG inner core includes multiple layers of a high resiliency material to provide superior striking protection through enhanced energy absorption. Vylar is a new high-performance leather material that has superior resistance to abrasion, cracking, and tearing. Coming up next, a very special guest who has a little first-hand knowledge about these gloves. Hi, welcome back everybody. I'm Dr. John Knight here along with George St-Pierre, the welterweight champion of the UFC. George, thanks for joining us today. I want to ask you about protecting the hands when you're fighting. Wrapping the hand is a critical point before donning the glove. Can you give us a little chance to see how you put these on?
Absolutely. One thing I like to do before I wrap the hand, which is important, if you have a little injury, you feel a little discomfort, it's important you can massage it, or if it's no discomfort, what I like to do is these kind of stretches, I go here, fingers, it's important. The wrist, make sure everything is loose, It's like you need to warm it up a little bit, feel there's no tightness. When it feels good, now you start. So it's important when you wrap the hand, the thing that you want is to make sure you give a support to your wrist. That's the main thing.
Sure.
So the glove will give the protection for your hand,
okay,
but the support to your wrist is very important, because when you hit, you don't want, at the moment of the impact, you don't want your wrist be bent. It will dissipate the energy of the impact. You want the impact be at the end of your knuckle. Okay. That's what you want. And also for the injury.
Right.
If it's the wrist is bended, more risk of injuries.
Sure.
Wrist is a small joint. It's very sensitive. You don't want to damage this. So the way I do it, all right, with this Hayabusa wrap, you see there is a side. So this side goes up. I like to start with the thumb, like a sign like this. Start with the thumb. I like to go 3 times around the wrist. 1, 2, 3. Never tight, not too tight. You want to let it breathe. You see, I don't feel any tightness, just for a little support. Then I come back two times. 1, 2. I like to go against around the thumb. After the thumb, I'm gonna go again around the knuckle. Only 1 turn around the knuckle.
How tight are you doing it? Really tight?
Not too tight at all. Like not too tight. You don't want to lose. You cut the blood circulation. Sure. And when I go around the knuckle, it's important. You see my finger? I create space, never like this, because it's important. I leave a big space, because at the end you will feel big discomfort if you wrap it too tight. So I go around the knuckle. My fingers stay always like with a big space. Then I come back again around the wrist. That's where it starts to be interesting now. You see? Now I'm gonna go between
each finger.
Each finger. I start with this one, and when it's time to go around the wrist, I close my fist, because at the moment of the impact, your fist will be closed. I go around the wrist 1 time, open up again, close my fist, go around the wrist, and the third one I go upside down. You see, I go different ways.
Okay.
Here, and I.
So you come from both directions, back and forth.
Yes, yeah. Yes. I close my fist, and never too tight. Like I said, it's just for the support. The goal is not to do it too tight. After I'm finished between the fingers, I open again, and I go around the knuckle 1 more time. I can go 2 turn, 1, 2. I got around the knuckle, and then I'm gonna finish the whole thing around the wrist. 1, 2, 3. There is many ways of wrapping hands. Sure. I don't say my way is the best one.
Sure.
There is so many ways. Like. You're making a knot, or tie it up your belt, in a gi. your gi. There's many ways. I like this way, and I never had major hands injury. I try to keep it this way because I always protect myself very well.
Right, and I'm assuming the next big thing after proper support underneath the glove is obviously a good glove.
Yes.
Just as far as your opinion of Hayabusa, the Tokusha glove here, tell me a little bit about it and about the great support it gives you across the wrist.
So it's important, okay, when you wear a pair of gloves, it's important to take the right side. If your glove is too big, you increase then the risk of injury. And that's another detail. It's important when you spar. I think everyone that sparring, they should use 16-ounce gloves. All right. Just if you're a very small person, you know, for a small weight, maybe 14. But most people, I would suggest 16-ounce glove. Very important for sparring. When you hit the pads and the bags, I like the 10 or 12-ounce glove. Okay. The reason is I don't want to damage my sparring glove. Sparring glove, I keep it for sparring and hitting the bag, working, I would call it working gloves, like the bag and the pad. I call it, this is the 10 and 12 ounce. Okay. And it's lighter, it's more realistic. So then I put my gloves in. One thing that I like about the Hayabusa glove, you see, there's an extra pad, there is an extra strap here.
And it goes through here. Yeah.
Yes, you put it and there is a hole here. You put the strap in the hole, like this, and you tie it. You can tie it tight, you can put it tight, right. So you maintain your wrists in perfect alignment. Right. Then after you go over the top with this one, and now you see everything is well protected, everything is aligned.
But it has this structural integrity here, right?
Yes.
That transfers the forces through the hand into the wrist.
Exactly, everything is tight, you know, you want everything keep tight. And you don't want to take a glove that is too big for you. You want everything tight inside. You want to feel your hand a little bit tight inside. It's normal in the beginning, but after you work out with it a couple of times, it will take the shape. It will more mold to your hand. It's a little bit like gloves, right. like gloves, like shoes. Same thing with running shoes for a sprinter. You like it tight. You want it tight, and your wrist is in perfect alignment right now.
Right. Well, clearly we've discussed equipment. Before we get on to the technique, I have to ask you a question. You've been in the news lately. Someone in the spot like yourself carries quite a bit of an influence. You've been quite an advocate for a stricter drug policy in the UFC. Yes. Can you tell us about that?
Yes, because I believe it's a big problem in my sport, and about the performance-enhancing drug. And I never wanted to do something negative for the UFC. I always be one of the guy that was fighting for elevating the sport. I wanted to do something positive, you know. So I don't want to accuse. I never accuse nobody, because I believe if you accuse one individual, 20 other will come. Or also, if you, it's not the UFC is not the problem. The problem is the sport, is the system. I wanted to change the system. Every great athlete I know in other sport. Judo, triathlon, any other sport, they can be tested, you know, at any moment, you know. But in MMA, it's a new sport. We don't have that. It's never been done before. And when I came up publicly and talk about it, I think we should do it. I received a lot of text message of fighter and reporter that told me like, hey, I'm very happy you did that. You came out publicly, because that's the main opinion of most of people, you know. And they want it to be done, but they're afraid to speak. They're afraid to lose their job. So I think it's something that they should consider and do in the future.
I agree. Thanks for doing that. On a lighter note, though, I'd like to, as a martial artist myself, I'd like to see a few pointers, if you could, on proper striking technique to keep novices like me from injuring our own hands. So, if you could.
There's many ways to punch. In karate, I remember when I was young, they taught me to use the first to hit with the first two knuckles.
For the two knuckles here.
Yes.
Yeah.
If you read Jack Dempsey's book, he says it's with the third knuckle, because when you hit with the third knuckle, it creates a perfect alignment of your arm. One thing you need to remember, you know, the reason why I use the strap, you know, it's important to keep the wrist. You wanna use your limb like this. The only part that can bend is the elbow. the wrist doesn't bend. It stay all one piece in here. That's very important. That's how the injury happen. When you bend the wrist and the impact, you lose the energy. You lose the force of impact because of this. You don't want that. You don't want the energy dissipate at this point, especially not in the wrist. It's too small. It's too sensitive. So when I strike, it's very important. I aim small and so I miss small. So I don't only target his face, I target a little point on his chin. That's the perfect spot to hit. If you hit the chin, he's gonna drop. It's connected right away to the brain. So I'm coming here and I use the energy from my feet and a twisting motion, and I keep don't forget, I keep my wrist straight and I strike like this. Boom! Everything is aligned. The power of a striker, of a strong striker, someone who has knockout power, it comes from the alignment. The mistake I do very often when I fight, and I try too much, I try too hard, so I messed up my alignment, and that's how that's the reason why I don't hit as hard as I wish to, because my alignment has a problem.
Sure. Well, I appreciate the instruction, and can't tell you what an honor it is to meet you and have you here at Hand and Wrist TV, and thank you for coming.
Thank you very much, Doctor.
Thanks for joining us. What an exciting show. Hopefully these tips can help prevent injuries to your hands and wrists when you're fighting. Join us next week as we look at tennis injuries and prevention. For more tips on injury, also look at highlights of our upcoming shows. Follow us on Twitter, like us on Facebook, and check out our website, handandwristtv.com. I'm Dr. John Knight. We'll see you next week.